State your name and age.
Hi, my name is Alisha and I am 28 years old.
What type of sickle cell do you have?
I have a full-blown type of sickle cell, SS.
Describe the first time you experienced a sickle cell crisis.
I actually had a crisis my first crisis when I was 9 months old, but I don't remember it. I would probably remember it when I was about 5 years old. I remember being in and out of hospital a lot, especially through my primary years. I remember my mum popping in and out a lot, my younger sister popping in and out a lot, and just me being around the nurses a lot. But I don't actually remember the pain. But I do know that it was a lot worse because I was in more than I am now.
Does anyone else in your family have sickle cell?
Nobody else in my family in England has sickle cell, so I'm the only person, and I'm also the oldest cousin. So that can be challenging at times because it's just me, and then all my younger cousins and siblings are okay. So it is hard sometimes, but I have got family in America that do have sickle cell as well.
What part of the body is affected the most by sickle cell?
In my experience, when I talk to people, it mainly seems to be the back where it starts first, and then it tends to branch off into other places. A lot of sicklers also talk about headaches, a lot of headaches. Now, we don't know if this is down to the actual medication or down to the actual crisis, or just the impact that the pain has on our bodies. But I do know that a lot of sicklers talk about their back a lot and their head. Mine tends to be starting off in my back.
What is your treatment plan?
Well, my treatment plan usually is when I get into hospital, my protocol is that I get an injection of methadone. Now, I know methadone is normally used for other uses, but because I'm allergic to all of the other medication, I have to use methadone as a painkiller. I take that as an injection. They usually let that last for 2 hours and then give me another injection. See how I am, ask me if I need to be admitted, and then we take it from there. And they normally give me a drip as well, just of saline water to help flush through the crisis.
Is there a lack of awareness about sickle cell in hospitals? If so, how?
There's definitely a lack of awareness about sickle cell in hospitals. Most of the nurses and doctors just give you the medication, but a lot of the time the nurses ask me, how does the sickle cell affect me? What does it do? Or they feel sorry for me, or they're praying for me. They treat the condition, but they don't actually know about the condition. This can actually be very scary. When I was in intensive care, I don't think any of the nurses knew about sickle cell, and I was actually in the intensive care, so that was a very scary time for me because not one of the nurses or doctors knew about sickle cell until my haematology team had to come up and talk to them. So there needs to be a lot more awareness with doctors and nurses. I know they train for a long time and they study for a long time, but I do believe that there should be an actual module on just sickle cell, so they know exactly how to treat it, exactly what it is, and exactly how it occurs.
What is your role for Sickle Cell Cause, and what does it involve?
I am on the awareness team. So sometimes I go into the store with our awareness manager, Karine, at the Sickle Cell North Middlesex Hospital. Also, if there's events going on, I will attend and I'll be at the tables. I'll wear my t-shirt and collect some money, just making sickle cell more aware to the community in all ways possible.
What does the George Marsh Centre mean to you, and why should it be saved?
The George Marsh Centre was made on the year that I was born, so ever since I have been alive, I've been in the centre probably once a year, at least been in the centre. So it means a lot because I've got a lot of childhood memories here. We used to have a lot of sickle cell children parties here. We used to do a lot of events here. So for it to go would be really sad because it's basically grown up with me, and I'm 28 years old. It's basically 28, same age as me. So it would be so sad if we actually lose our building. it has so much memories and so much meaning, and it can be used for so much more if it was in the correct in our care and in the correct hands.